Given the pandemic, now more than ever, being able to decipher fact from fiction is crucial when dealing with anything health related. So tonight we're going to cut through the hype.
Busting the biggest medical myths, from vaccines to supplements, bottled waters to vitamin waters. And can you get accurate information from the web when it comes to self-diagnosis?
Hype, a doctor's guide to medical myths, exaggerated claims, and bad advice, covers the most common misconceptions that people have. And the author, Dr. Nina Shapiro of UCLA School of Medicine, joins us now live to discuss all this. We have your book in hand, both Alex and I. It's good to see you, Dr. Nina.
Great to be here. Thanks for having me.
Before we get to all the goodies inside, we do want to get your thoughts on the halting of J&J. You just heard our conversation with Dr. Ian. So do you think that they are overreacting?
Not at all. I think it was a very good move on the part of the CDC and the FDA. And again, it means that they're taking this seriously. 6 patients in 7 million is a very, very low number, unless you're one of those 6 patients or horribly the one patient who died. So we need to take it seriously. I think something that's really important is we need to find out why this happened. Is it related to the vaccine at all? And if so, why were these women more susceptible? What mechanism was going on? I think we don't have the answers yet. And until we have those answers, we need to keep this pause going until we understand who is really at risk for this, if at all, if it is even related to this vaccine. Likely there is some connection, but until then, we have to consider it an association until we really understand the cause.
Do you think Johnson & Johnson is essentially done as a vaccine, even if everybody is given the all clear that people are not going to want to take it now?
You know, I really hope not, because it was really the answer for so many millions of people, really billions. We need to vaccinate Los Angeles, we need to vaccinate California, we need to vaccinate this country, but we need to vaccinate the world. And until we do that, we are not over this pandemic. So if there can be something that can be found to identify how to prevent this and who's at risk, let's say it was only women, maybe only men should get this vaccine, or only people over 50 should get this vaccine. If there's something that can be designated to find out what was really the problem with it, I think then we'll probably have a better chance of moving forward. But we really do need this vaccine.
Yeah.
We do.
It needs to be salvaged. That's what you're saying. And speaking of LA County, only about 25% of the residents here have been fully vaccinated at this point. All right, let's get to Hype, your book, and let's talk about some of these myths that we want to debunk. Vaccines, including the COVID vaccine, can cause the illness they are meant to prevent. Myth?
This is a myth. And, early on in vaccine history, so we're talking about the smallpox vaccine, which was one of the most remarkable vaccines in history, but it did actually give you a little bit of smallpox virus. The very early polio vaccine did have actually some polio virus in it. And some people actually got these diseases from these vaccines, but this is no longer the case. There is no COVID in any COVID vaccine, including Johnson & Johnson. There is no illness in any of the vaccines that children get during their early childhood. So it is really important to know that, and there is no flu in the flu vaccine. We haven't talked much about the flu vaccine this year, and thankfully we've had a very, very low-level flu season this year, but you do not get the flu from the flu vaccine. I think we need to keep saying that. There is no influenza that will give you the flu from any vaccine.
Interesting. Here's another potential myth. High-dose supplements prevent diseases.
So this became a biggie this year, especially with COVID, because the idea of some high-dose vitamins, including vitamin D, vitamin C, and zinc, which is a supplement, would prevent COVID or prevent bad outcomes from COVID. And there is some really good data that these supplements can help in severe illnesses. They will not prevent COVID. So taking these supplements are not a barrier to COVID. We know what the barriers are, which are distancing, masking, and the vaccine. But the supplements alone will not really prevent any illness. And unfortunately, they don't really treat any illness as standalones.
Okay, how about this? I drink vitamin water and Propel that has electrolytes religiously. So bottled waters such as those, are they better for you than tap water?
So bottled water, first of all, let's talk about the bottles themselves. So the plastic waste that we have in this world, I read some figure that 1 million water bottles, plastic water bottles are bought per minute. So in the world. So there's too much plastic from these water bottles, first of all. Second of all, any of the electrolytes or the alkaline quality of the waters just gets literally washed out and neutralized. Your stomach is full of acid. So whatever you drink that's alkaline is going to be neutralized before it gets anywhere else in your body. So tap water, if you have a good, safe tap water supply, is still the best water. And you do not need to drink 8 glasses of water per day. That was something from the 1940s. And most of that is actually in the food that you eat.
Wow.
Apparently,
I was very surprised by that one.
Apparently, Dr. Nina is not a lobbyist for the alkaline water companies. And lastly, top site on your Google search provides the most accurate information. Real quickly, Dr. Nina.
So real quick, no. So this is great. A lot of the top search on your Google search is an advertisement. And you can see that little green box that says ad. It's a brilliant way. We're using keywords and search engine optimization to get your search site high, but it's not necessarily the most accurate information. It's the one that has the highest advertisement value.
Very good. Dr. Nina Shapiro, thank you. Hype, a doctor's guide to medical myths, exaggerated claims, and bad advice, out in paperback, as of today. Thank you so much, Dr. Nina.
Congratulations. Great to see you.
Stay well.
When we come back, Orange County considering a proof of vaccine program.